now we're going to look at some of the examination basics for hip internal rotation. So we'll have Amanda start by internally rotating her right hip. Okay? We have the patient internally rotate as far as they feel they can, and they walk alongside a treatment table, and they can hold on to the treatment table if they need to for balance. Good. And again, we ask impairment-related questions. We ask the patient if they feel any discomfort or any stiffness as they perform loaded hip internal rotation. Now let's look at your involved side. Let's have you try to rotate that left hip as far as you can. And we can clearly see the patient doesn't want to rotate internally as much. So try to walk on that now. And again, we ask impairment-based questions. I can see that you're not internally rotating your hip as far. Is that due to discomfort? Is that due to stiffness? Or do you just feel like you're not able to? At that point, we can continue the examination in a standing position. So we'll have Amanda come here. And we'll focus on, again, this left hip that was not able to fully internally rotate. So let me have you bend this left knee, okay? And we'll have you make this motion like this. Okay? Again, we'll ask impairment-based questions. How does that feel to the patient? Is it painful? Is it stiff? We'll have the patient actively internally rotate as far as they can. And at the end of that available active motion, we deliver an overpressure test in the direction of internal rotation. We ask the patient if there's discomfort. If there is, we have the patient clarify what was the intensity of the discomfort, what was the character of the discomfort, where was the location of the discomfort. Return the hip back to a little bit more of a neutral position, and use repetitive, passive movement to feel the first and final stop as we judge the end feel for hip internal rotation. And then for the sake of completeness and to potentially identify a weakness impairment affecting hip internal rotation, we'll perform our basic manual muscle test. So we'll have Amanda actively internally rotate. Do that one more time for me. I want you to try to hold that position as best as you can. Hold against me. And we press in that direction to see if there's a weakness impairment affecting some of the muscles which produce active internal rotation at the hip joint.